Tell me a little bit about dental health. Tell me a little bit about what you tell new parents they should be doing to help their kid have that dental health.
I think one really important thing to understand about dentistry is you can't bullshit dentistry. And what I mean by that, and I heard a great quote once, and this goes, I'm going to talk on cost and then come back to what I would actually tell a parent. It's like dentistry is not expensive and it's not hard. Neglect is expensive and hard. So what young parents just need to know is there's nothing hard about it. Like me, it's very hard to parent. It's very hard to parent a little kid. But as far as like dentistry on its own, it's actually like super simple. Just wipe their teeth once a day to make sure bacteria can't eat away at the tooth structure. The analogy I always use is an apple. So you can't allow, you get the little brown spot in the apple and it spreads. The whole job we have of maintaining our teeth, it's so simple. You just have to keep the surface clean enough that the bacteria can't make a hole in your tooth. So for a young person, young family having a kid, when they come in for an appointment, it all just comes down to, hey, before the kid goes to bed, take a little face cloth that you have, wipe the front of their teeth, wipe the back of their teeth, make sure the milk's not sitting on their teeth. And that, like, super simple. And this is why dentistry is good for me. It's super simple. Is the problem is people don't know. So they think it's like way more complicated.
My firstborn had bottle rot.
Bottle rot, because no one probably said wipe it.
I'd get him all capped or like fake teeth at 3 years old.
Yeah, it's terrifying, man. I've had kids where I have had to, on a 5-year-old, take out all their teeth.
Yeah,
and you can't give them dentures. But it just comes down to communication. So I think sometimes people have a lot of anxiety, so they worry about like what they're supposed to do. It's putting the kids to bed with a bottle. People don't know that they shouldn't. So milk has sugar in it. So what rots teeth is sugar. So
and he wouldn't go to sleep unless it was a bottle.
Unless there was a bottle.
So he'd have to fall asleep sucking on it, and like we had no idea.
Yeah. The other thing I also say is like there's no shame in that, right? Like you didn't kill the kid. No. Like, yeah, you got some cavities, you got them.
And he had the best damn teeth for the next 2 years after
2 years.
Yeah. So he had 4 fake teeth.
Yeah, it's amazing.
Jimmy actually got him grills.
The metal ones? Oh, that'd be amazing.
Ball with it.
They come and go. Yeah. So for a young person with young kids, it just comes down to hygiene. The hard part is when things go the wrong direction. If you don't have the means and the access, then it becomes difficult to figure out how you deal with it. Very often kids have to be put to sleep, so that creates a huge burden and anxiety on the parents.
Oh my god,
it's so worst, stressful.
My little guy, she's like, can you hold the, like, it was to put the gas mask over him. Mm-hmm. So I had to hold it over him, and I'll never forget those like 5 or 6 seconds.
Oh, terrifying.
Because he was like fucking losing his mind, like I was like smothering him. Yeah. And like you got to hold it on him while he's like, his eyes are just rolling and he's like fighting it like crazy, man. Like that is the hardest moment I've ever had with him, because like I'll never forget that moment.
Did you find like once he was asleep too? I found that when like a bit terrifying, because you're like, oh my god, this little.
I've had some weird experience where like I had like a little cousin that like passed away. And,
oh my
like,
god!
So like like he had cancer when he like since he was born, and like battled through it for a couple years. So like I've had weird experiences with little ones. So like that part didn't bother me, knowing he was sleeping, because I was like okay with it. He's but calm, like. Yeah. The fact that I was putting him through that torture, like I couldn't.
It's traumatizing to everybody, right? It's so traumatizing.
But he didn't remember it when he woke up. Like I waited a few days and like, hey, like, do you remember being at the dentist? But like he didn't remember that part because it was like so scarring.
Again, this is the beautiful part of where we are, because you can get an anesthesiologist who we have access to put a child to sleep.
Yeah.
In a safe environment, you have access for people to do the work, and then it's all good. You forget about it. It's amazing.
Yeah.
Back to your point about like advice for young
tell
parents.
me the cloth. I'd never heard that.
That's such a simple idea, and I've never heard
it.
It's
super simple. But the thing is, like, people think this is like some magic thing that causes decay or that causes infection. It's just bacteria, and our teeth are not meant to handle bacteria sitting on them for long periods of time. So I just tell parents they could take a washcloth. We all have those little 4x4 inch washcloths that we wash their face with. Before the kid goes to bed, you wipe. If the baby can't, or if the child can't go to bed without the bottle, like the milk, first thing you try to do is slowly wean them onto like warm water or something. But again, this is hard to tell parents who are exhausted and at their wits' end. But once the child is asleep, pull their lip, take the cloth, wipe the front, wipe the back at least a few times a week so that bacteria can't sit on there. Because all the bacteria wants to do is sit on there and eat.
I think
and
all we ever think of what is a toothbrush, right? We would never, it would never cross our
minds. You don't need
like,
to brush the 9 months old teeth, right? You don't need an actual toothbrush. So that's what I'm saying. We make it harder than it needs to be. And a lot of that is communication and access to care, access to someone who can tell you, hey, just take a cloth, wipe the front, wipe the back, you're done. 6 seconds, you know?
Yeah. I think the problem is that like most parents wouldn't take their kid to the dentist that early either, right? So like, how do we get that information out there other than podcasts like this? So it's hard to get that info out to those parents.
So the pediatric associations say take your kid to the dentist in your first year. But most parents are like, why would I do that? Because they're thinking of like the teeth. But the reason the pediatric association says that is for the conversation. So what I typically do in my practice is if I know someone's having a kid, you don't need to bring your 9-month-old who's screaming and crying and exhausted to the office. I'll have the conversation with the parent and just be like, hey, bring your kid in like when you can or when it fits your schedule. But it says having the conversation is important. And it goes back to like our profession sometimes is like it runs too rapid and it's too transactional. And that's where like having relationships is so important. Because like in our practice, you say 50 years old, like we have really good relationships. So grandma will tell you that her daughter is having a kid and you note it because you know who the daughter is and you can have the conversation. So in community-based practices that have been around for a long time, those conversations get had more often.
Right.
In environments where it's more of just a transactional relationship, you show up, you get your cleaning, you don't know who's cleaning your teeth, you don't know who your dentist is, like there's no family relationship, those conversations sometimes get missed out on.
Right.
Yeah.
So first conversation with your dentist in the first year, try and keep milk off the teeth, go for a little wipe if you can with a dry cloth, right?
That's the main thing. Dry wet, it doesn't even matter. You can't have food debris or milk sitting on the teeth. Yeah. Like that's it.
And then fast forward a little bit. When do you like starting? Like when should a kiddo be booking in to see a dentist? And when does brushing start? Flossing start?
So the kids are variable, right? In terms of their personalities, in terms of their ability to sit down for a moment, in terms of their ability to adapt to strangers. So I often, to me as a dentist, I think the most important conversation is the ones I have with the parents. I usually say if your kid hasn't been in by 3, they should be. So the official stance of the dental associations is 1, which is idealistic. And if you can, great. By 3 for sure. And the point of by 3 is some of that bottle rot stuff, if it can be caught at 3 and fixed up pretty good. If you wait till 5 or 6, then it's too late. And that's the story of like the kids where I got to pull out all their teeth. And now the kid has no teeth until he's 7, 8 years old. And it's just the front ones. It gets awkward. So ideal 1. Secondary would be like 3 would be a benchmark for sure. Just again for conversation and just getting the kid comfortable in the environment. For the dentist having a quick enough look to be like, hey, I see some problems, or hey, you know what, you're doing great, you're genetically lucky, whatever it is. And then the regular routines usually, in terms of cleanings and that stuff, usually start around 6 when the adult teeth are in. So 3 to 6 is kind of a variable zone. Usually between 3 and 6, I'll see the kids once a year just to check up, catch stuff when they're little. Because the other big thing is anesthesia, putting kids to sleep, right? You don't want to be putting little kids to sleep too often. So the goal in that 3 to 6 age range is catch stuff super quick and fix them when they're small. So if I use the apple analogy with the decay of the apple, you don't want to wait until half the tooth is rotten. You want to catch it when the rot has just started. You can do it usually in 5 minutes. You don't have to put the child under, so the parent doesn't have to go through the emotional trauma and the expense of putting the child to sleep, and you go from there.
And then when it's time to start brushing, like what do you tell kiddos? What should they use? Are they using toothpaste from day one? Are they using?
So as the teeth come in, I tell the parents like usually around 3 or 4, kids like to mimic their parents. So sometimes people come into the office and say, "Oh, I have bad teeth. It's genetic." Now, I think 99% of the time, your habits are your habits are what's passed on. It's not necessarily your teeth. So, usually, what I tell parents is around 3 or 4, when the kid can start to kind of do stuff on their own, let them do it on their own. And a lot of parents try like break their back or break their neck trying to clean the kid's teeth in the bathroom the same way we brush our teeth. That's not how you brush a kid's teeth. The way you brush a kid's teeth, you lay them down in bed. You don't need fancy toothpastes. Again, it's just literally debris on your tooth structure needs to be removed. So the best way to do it is when the kid's laying flat in their bed, they open their mouth and you go in with a toothbrush and you brush. And
3 boys, and I've literally never been told any of this.
yeah. So, and then the back 2 teeth in each corner have to last till the kids are 11. So those are the ones where we see the kids with the big silver crowns. Those teeth rot a lot because they're usually tight together. So when the kid's laying back and their mouth's wide open, the parent can see the upper teeth and the lower teeth fully. Whereas when they're standing vertical at a mirror, you can't see nothing. You see the front 4 teeth. You can't help them. So lay them down, brush the teeth if the kid can't do it on their own. And then the big one is if their teeth in the back are tight together, you want to just get the floss in between, the little floss picks, what do you call them?
The kids flavored ones.
Yeah, the kids flavored
Crayola
ones.
makes them and stuff.
And yeah, they open their mouth and you see the top and the bottom, and between the back 2 teeth on the top, both sides, you get the floss in. Bottom teeth on, you get the floss in. And if your kid's in a good mood and staying open, you keep going. One of my good friends, he's a pediatric dentist in town. Shout out to Burlington Pediatric Dentistry. He's awesome. And Dr. Charlotte. And I think at one point he posted a video because he's got 3 boys. And this is gentle parenting as it goes out the window here. But sometimes you just got to get the job done. And so he had a video at one point where his boy was laying in his lap and he had him in a headlock. So the kid's laying down and the kid's screaming. And he goes, the best thing your kids can do is scream because their mouth's wide open. And he goes in and he goes, clean it up. And the kids don't remember nothing before they're 4 years old. So they're not going to be emotionally traumatized. I don't think so anyway. And you get the teeth clean. So if they're screaming and yelling, sometimes first time parents, they tend to be the gentlest parents. Like the kid's screaming, yeah, it's fine. Like the kids scream, that's what they do. Like they want everything their way. If they yell and scream, they're gonna forget. They're gonna scream more if they have an infection. They're gonna scream more if they have an abscess. They're gonna scream more if a dentist has to give them a needle. Just 10 seconds, let them scream, clean it up real good.
So
good to go.
Question, and I know that there's no right answer from coming from a dentist, but like, what's the better option? So, I drink Diet Pop. I don't drink anything with sugar in it. So like. Red Bull, I drink it sugar free, but my kids, in my mind, I'd rather them drink a Coke if they're going to drink something, or drink, a Fanta or something like that. And I understand that there's sugar in it, but in my mind, I'm like, well, I'd rather give them that than aspartame. I don't want to pump them full of like other drugs that are in there. But Gatorade, I do have them drink Gatorade Zero instead of regular Gatorade because it's super jacked up in sugar and stuff. From a dentist point of view, like I know they should be drinking water all the time, but like if they're going to drink something, like should a kid be drinking a diet something or should they be drinking a regular with sugar?
Is my official answer or my dad answer?
Both. Give us both.
The official answer is your kid should be drinking water. Why is your kid drinking sugared up drinks? But as a parent whose kids drink sugared up drinks and as a dude that drinks a lot of Coke, the reality is the reason the pops are bad is because they're acidic and they're sugary. So acid and sugar are combined to create a lot of damage. The worst one is Mountain Dew. So if I had to say don't drink anything, it would be Mountain Dew because it's like super acidic, super sugary. So that causes the most problem. But in the end, as long as you clean them, you're fine. Unless you're that super small minority of people who actually genetically have super weak teeth.
What's your take on the diet stuff for kids?
In terms of aspartame?
Yeah.
I would stay away from it. I would rather natural sugars than or regular sugars than aspartame because there's my undergrad was health science, so it was a big amount of emphasis on like try to keep away from all that secondary stuff because great, it's sugar free, quote unquote, but it's a whole bunch of other problems.
For sure.
And I have one of my best friends that I grew up with. He's a chiropractor, but he's like a real athletic trainer, like high level guy. He trains one of the Raptors, like health is like his main thing. And his thing is all the out of shape people I know drink diet, whatever. So there's just whatever it does to our body is so negative that it's better not to have it in your system. So I'm with you. I think if you're going to do it, just have the Coke and brush and floss and go on with your day.
Right.
When do you start introducing? Have a sip, man. I feel like you're in the hot seat right now. Sorry to do it to you. Cheers.
My answer's okay. No, I don't know. Great, are you kicking me out? I haven't cried yet. You promised me I would cry.
ChatGPT will tell us after.
Yeah, that's right. Cheers, man.
I can talk for 50 years. It might be here forever.
Well, no, I'm interested too because this is shit that I haven't heard. So this is great, man. So the other thing is just going chronologically then with kiddos. When do you start introducing fluoride? Like when do they start using toothpaste?
So the the answer is when they can not swallow. So again, this is your kid better than anybody else, right? Some kids are like silly, some kids are goofy, some kids don't have the dexterity to be able to like realize what they're doing. So some kids, if you give them toothpaste, they'll brush and they'll swallow. If they're swallowing, you don't want to be ingesting fluoride. We hear of RFK and he's getting rid of fluoride in the water. Fluoride is good, like most things in the world, is good when used properly and bad when used improperly. So if the kid is at the stage where they can brush and spit and rinse and spit, which is usually around 5 years old, you're good. But if you find that you're giving your kid the toothpaste and he's like, "Ooh, this tastes amazing," and just wants to eat the whole tube, then yeah, don't use fluoride, because fluoride's an adjunct, right? So again, it helps to clean the teeth and to harden the teeth so you don't get decay and they don't fall apart. But if you're brushing every night and you're flossing and your diet's reasonable, may not be necessary. So I wouldn't push fluoride to a young kid to ingest, thinking that for the dental benefit. But once they get to a point where they can apply it topically and then rinse and spit, then they're fine. Usually around 5 or 6 years old.
My 5-year-old's the opposite. He puts toothpaste on his toothbrush.
Yeah,
Just
so
like,
that kid
he
is
spits like every 3 seconds. I'm like, dude, like you've done
fluoride.
You put toothpaste on like 5 times in the last 3 minutes. I'm like,
as long as
it's
he's
great that you're
brushing the
doing
teeth,
it, but like just keep that shit in your mouth for a little while. Like brush it. Like I want to see it
Just get
dripping
to
down
that.
your face. Like that's when I know you're brushing your teeth.
Exactly.
And then my 11-year-old, like he'll brush his teeth and like nothing, no bubbles in his mouth. I'm like, dude, you're barely putting any
Barely touching anything.
toothpaste
Yeah,
on there.
for
Like,
sure. The worst is when they brush, like, the one thing conversation I have with like young kids is like, don't just brush the teeth you can see. Because what we see is like the thing that rots like most often is upper back teeth. Because the kids will stand at the mirror, open their mouth, they see all the bottom teeth, and they see their front 6 upper teeth. But they don't see any of the upper back teeth, so just ignore them. So that's another thing I usually tell parents and kids is just like, don't forget you have teeth up there just to clean them.
Okay. And then flossing. When do we floss? So
You know what? Shit my dad taught me. So I never forget, man. So remember, I became a dentist now because I was a lifelong, I have so much dentistry.
start flossing 2 weeks before your dental appointment. Because then that way they don't get pissed off with you when your gums start bleeding.
That's the bare minimum. That's the dad answer, right? I never forget, man. I used to sit as a teenager in the house and my dad would be flossing his teeth. And I was like, this old man is so weird with this string. But the reality is, you floss the teeth you want to keep. So the same guy who I thought was weird is now 82, 83 years old and still have all his natural teeth from the third world. This is not first world stuff. It's like working out, man. If you're consistent and you make it part of your habits and you maintain yourself, you're going to be good. Flossing is the same thing, though. The sooner the better. For little kids, like once those back molars come in, it's on the parents to try and get in. It's on the dentist to teach the parents. It's on the parents when the kid's laying down to clean between those back 2 teeth. And then the hardest part is teenagers, right? Like, I don't know. You guys have teenagers? You have a teenager. You have a teenager.
11 and 14.
11, 14. Yeah, so you know.
I'm not there yet.
So I find girls are pretty good because they're big on hygiene. Boys care not for hygiene in my experience. So it's trying to teach them to floss and clean. And then that's when most of us, myself included, had most of our cavities. Yeah, flossing all ages would be the ideal answer. ASAP is if you're not doing it, start ASAP, because that actually, you talk to different people from different walks of life and you have to frame things differently. So to the teenagers, I'm like, you got to floss so stuff's not between your teeth so it doesn't smell gross, so that the girl you have a crush on doesn't smell your bad breath. To the kid in their 20s, I'm like, you got to floss because you don't want to spend $3,000 fixing cavities with me. You want to spend it going on vacation with your girlfriend. So to older people, you got to floss so that you don't end up having to spend tens of thousands of dollars rebuilding your whole mouth. So in the end, like, again, dentistry is not hard. You keep the bacteria off the teeth. You're good to go. It's 2 minutes a night. We all do all sorts of stuff. You guys probably do stuff 2 minutes a night. No.
Hey,
On this episode of Who's in Your Mouth.
So yeah, flossing, the earlier the better, but if you haven't started.
So take your business hat off, but put your schooling hat on.
Mm-hmm.
How often should I be being convinced to get my kids in my mouth x-rayed when You know, is this like every second time that I'm going? So every like second 6 months checkup, do I legitimately need X-rays at 42 years old?
Great question.
My benefits only cover them every 2 years.
I have this conversation all the time, and I think this is the hardest part about dentistry is like the communication and explaining to people. And I learned this in dental school, is like there's actually no right answer, because I have people who come into my office every 6 months who do their best, but whose natural bacteria in their mouth is so aggressive towards teeth that they get cavities every time they come in. Those people should have X-rays every year for sure.
That's my wife. She's like, she's got really bad, like she takes care of her teeth like crazy, but just like
it just happens.
Yeah, like she's cost me 30 grand in the last like since we've been married. So I've never had a cavity in my life.
So part of it, we talk about like hygiene as a big thing with dentistry, is like that's the thing you can control. What you can't control is the natural flora you get in your mouth. And so there's 3 types of people. I kind of categorize them into 3 types. The bacteria we have in our mouth is different between everybody. One group of people has bacteria that's really aggressive towards teeth, so they get a lot of cavities. So the bacteria want to eat away at your tooth structure. That sucks. There's another group of people whose bacteria are really aggressive against the gums, so they don't get a lot of cavities, but every time they go to the dentist will talk about, oh, you've lost bone, you've lost gum. And then there's a group of people, the unfortunate group, where they have both. And those are the people who usually in old age end up with no teeth. And then there's one group that has neither, and they can not brush and not floss, and they show up and their teeth are fine. And so the answer is different for everybody, because we're not all built the same, right? We all have different makeups. So again, in my practice, like getting to know your patient and the patient getting to know you is important, because yes, there's some people that I need an X-ray every single time you're in. Not because the $20 changes my life. It genuinely does not.
Like
or whatever. I don't even know what it is.
You probably don't.
I genuinely don't know.
But the girls that work for you that are upselling them, they know how much it is.
They do. So there's one group that really needs them. To me, the way I reframe it, a lot of life is framing. I'm like, okay, listen, what is it? It's not $290 for an X-ray. No way.
It's over 200.
Hey Siri, how much is a bite wing X-ray in Ontario? Hold on, let me show you. I think it's $43.
No.
You're right. The full checkup is probably $43. So anyways, the takeaway is, if you're high risk, high caries, the reason I take an X-ray on a patient is not to make the $40. It's I'm taking the X-ray to catch the thing when it's small. Because what ends up happening is like, say I take the X-ray every year, right? We're talking about cost, and we're talking about radiation, and we're talking about the after effect. If that X-ray catches a cavity when it's small, okay, $220, whatever it is, for a small cavity. If I don't take that X-ray and I take it a year later, and now that cavity is so big that it's become a root canal, and now you're $2,500 in, and a root canal and a crown, it might be $3,000. If we don't take that X-ray for an additional year, and now the whole thing is rotten, now you're pulling the $2,000.
So you can't see most cavities like just visibly?
On the surface, no, and that's the problem. So we see visually. What your toothbrush touches. So when you brush your teeth, it's all the exposed surfaces, right? So I can see all the exposed surfaces with my eyes. But the parts that you floss, the spots between your teeth, I can only see once they get to about 20 or 30% of the tooth structure being damaged. Because these bacteria are so smart. Am I going to give you guys an anatomy lesson here? Is this too boring? You stop me. I wasn't going to go into that.
I want to hear your best pitch to sell this guy on an X-ray.
No. So
lay it on.
So the tooth is like an apple. I'm going to use that analogy again. So you have the skin of the apple, right? So what the bacteria do is they try and pierce a tiny little hole in the skin of the apple to get into the bulk of the apple, the inside, which is softer, which is more nutritious for them, which they can eat away at. So what they do is they make a tiny little pinhole. So let's say between your teeth where I can't see and your toothbrush can't touch where the floss goes. They make a tiny little pinhole and they bore a hole in about 1 millimeter or 2 to get to the bulk of your tooth, which is the second layer. And then they start to eat away at that. And the only time the dentist will know is once that inside tooth structure is eaten away so that the outside shell collapses. So you need the outside shell to collapse. By that stage, 30% of your tooth structure is gone. Now you're closer to a root canal or a big filling or a crown. So no, visually we can't, and that's the dilemma.
The shit Shahab teaches you.
Sorry, man.
Yeah,
Sorry.
Don't be cheap, bro.
Follow through on your jump shot.
Always follow.
I've learned it's only supposed to be $43.
So yeah, you look up the X-ray. But the takeaway is typically I have this conversation with my friends, right? Because I grew up like the environment I grew up in. A lot of my friends are like, "Nah, you're just scamming people." I'm like, "I'm not scamming people." I'm like, the entire goal of that X-ray is to catch stuff when they're little. So you don't actually have to end up spending a ton of time.
It's to pay for your third Lambo.
Bro, no.
It's for your third Lambo.
The implants, once your tooth fails, is what pays for the Lambo.
But implants aren't usually being done by the dentist anyways, right? You're handing that off to...
Yeah, usually it goes off to the specialist or whatever. Yeah. So back to your answer. Usually we're not taking x-rays to make the money because that $40 isn't going to make a huge difference. Most dentists are geared towards your best interest, so they're trying to catch stuff early.
Right.
That being said, like every other profession, there's 12% who are ridiculous and are out for your money, and they make it hard for everybody else. And so again, I think with doctors, with dentists, I think relationships matter. Long-term relationships matter, and communication matters. Because if you're showing up to my office, we know nothing about each other, and your concern is that I'm taking advantage, it's not a healthy relationship.
For sure.
If you're showing up to my office and my genuine interest is paying off my Lambo, not a good relationship. So long-term
maybe I like your Lambo.
Long-term relationships matter, is the takeaway, and risk matters. So for you, so you use your example, like probably every couple of years, just to make sure nothing horrible is happening. For your wife, who says, do it more often, because you're going to catch
every 2 years
stuff.
she has to get something done anyway.
Just catch it early and solve it. The numbers are actually like, it's kind of crazy how it escalates. So like a filling, let's say like $250 to $300. If you don't catch the cavity while it's in the filling stage, and it goes to the next stage, now that's a root canal and a crown. That's usually about $2,500 to $3,000. So that's $2,000 jump in solution to solve the problem. And then if you don't catch it at that stage, and it's to the point where it needs to come out now, there's a $6,000 tooth. So
sometimes there's not enough gum. Like my wife, they had to put like a gum in there, like put bone in there.
Poor Kate, everybody's learning everything about her mouth.
Like her teeth look awesome, but they look great.
I saw her at the golf tournament. Her smile's amazing. Yeah, her smile's amazing. But yeah, so our goal genuinely is to catch stuff early so it doesn't get into the more advanced stages.
Yeah.
I always tell my friends, if your dentist is driving a Lambo, you probably need a new dentist.
He does have a few nice cars.
What's
Chris, keep us on track.
Yeah. Is that my job today? I guess that's my job today.
Hey, we got to go off the rails.
You're the voice of reason
way,
for
way
once.
more
This
fun.
is good.
Yep, that's right. So my next question was just going to be about all the hype around some of these dental devices. Like, I know when you get to our age, there's guys using electric toothbrushes and water picks, and name your, solution you saw on an infomercial. Yeah. What do you recommend?
These things they put in their mouth and they light up like blue for like 20 minutes.
UV light one. Like, what should we be doing?
I'm going to give a shout out to Chris Sandell, who's a really good contractor that is a part of the Burlington Dads. And Chris, at my house, we had a flood. And when we were renovating the flood, I said, "Hey, Chris, I kind of want a gym in my basement." And he's like, "Okay, I'll build you a gym." I was like, "I want mirrors on the wall." And he's a hilarious dude, right? He looks at my body up and down. He's like, "You're not going to use the fucking gym." And I was like, I want the gym. So he built me a nice gym, and it has a treadmill, and it has weights, and it has awesome mirror and a good TV.
Still with the price tags on them.
I never use it. I sit there with a beer in my hand and a bag of chips to watch NFL games. So I have the fancy gym, but I don't use it. And it's the same thing applies to the dental tools. It's like, it doesn't take a ton. Like in the third world, they use branches off of trees and they splay them and brush their teeth. And if you use it, it works. And all the other gimmicky stuff, the stuff off Instagram, like usually garbage. I order most of it just to like try it out, but I wouldn't go too far. I think electric toothbrushes are huge. I think those are important. I think at this stage,
better or worse for your gums though than a regular toothbrush.
So you have to use it different than a regular toothbrush. So we're all around the same age. We're of a generation where you use the toothbrush and you have to scrub and go in circles and whatever. The electric toothbrush is more passive. It's doing the work. So all you actually have to do is run it along, like just create the contact time. So it's touching each part of your tooth and your gum. It will do the work for you. Where people run into trouble is when they use an electric toothbrush, like a regular toothbrush, where they're scrubbing with it, because now they're putting pressure and it's vibrating and it creates some damage. The newer ones actually will beep at you. I got a Sonicare one, as a dentist. I started using it, and it started to yell at me because like too much. It go beep 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 because I was pressing too hard on my gums. So the idea is the electric one does the job. It's better than a regular handheld toothbrush, but you have to let it just ride along the gum line. You don't have to scrub or push or do anything crazy. Just run it along the gum line. Water picks for I recommend it. I do some implant work and a lot of bridge work and aesthetic stuff. I recommend that for all my like older patients because one thing with age is our dexterity changes, right? So when you have high-end dentistry that's not natural stuff, the water pick is just like a super water jet. It's a power wash, right?
Yeah.
You just power wash your teeth. It makes life easier than trying to get into every nook and cranny by hand. Because when you're 80 years old and you got $50,000 worth of dentistry in your mouth, you can't floss every nook and cranny. So electric toothbrushes and water picks I'm a big fan of. But for younger people, people with their natural teeth, just whatever you're going to use, as long as you use it.
Yeah.
Reasonable. Instagram, let me tell you. Instagram
I remember growing up, like I grew up in Thunder Bay, like in the middle and out in the bush. I remember watching my dad. He would like dip his toothbrush in peroxide and brush it just peroxide. And like I tried that once when I was like, I don't know, my mid-20s I did it. And I guess I had like a little cut on one of my gums or a mark.
That hurts.
I fucking burned like crazy. I'm like,
but it works.
Stubborn son of a bitch did this every day, every couple days.
Yeah. My brother-in-law, he's an Albanian guy. He's perfect teeth. And like he grew up like in the hills of Albania and never had a cavity, no problems. And he's like, I just rinse with salt and water. What's the problem? Like, yeah, you use salt. It doesn't matter what you use. As long as you don't let the bacteria sit on your tooth and you don't get the flora in your mouth get out of control, you're usually good. I had a patient. This is a whitening. Whitening's a fucking, it kills me, man. Somebody bought whitening off of Instagram. And so the problem with online stuff is there's no regulation. You don't know where you're getting it from.
With the amount of peroxide in it and stuff.
So it's okay. Like if you buy a shirt and it disintegrates in the wash, it's fine. If you buy shoes and the sole comes off, it's fine. But for anything like health related, I had one lady, she came in and she bought whitening off the internet and it literally ate away at all her teeth. So we actually had to do 30 grand worth of crown and bridge to rebuild her teeth. So I tell my patients, I just paid $100 at Shoppers, because you know what? Shoppers,
you can buy it from your dentist. Like
buy it from your dentist.
Yeah, our dentist. My wife buys it from our dentist.
We do it at cost because I'm like, please just don't buy it anywhere else.
Just not much. It's like $40 or $60.
It's buy this thing at cost from your dentist. Like
you pay for the molding or whatever that you got.
Yeah,
but like
exactly.
Whatever.
It's not much. But people, we're all like big into fads. So she bought something off the internet. She came on. She's like, I whitened my teeth and all my enamel's gone. I had never seen anything like it before. So word to the wise in terms of health is chintz on certain things, but don't chintz on your
Don't
health.
buy those sauna light ones that glow in your mouth and come with the free
It's
butt
pretty,
plug.
man.
The matching butt plug.
It's hilarious because like
Miles is shaking his head right now. Going, fuck, I got sucked into the last one of those orders.
or maybe Googling it.
I got one right now.
Returning that, not giving it to the girlfriend for Christmas.
Just you know, like your dentist, your local drugstore, like they'll get their sued to the ends of the world if something like that happens. Whereas the random whitening you bought off of Temu, like there's no repercussion.
Temu whitening.
Temu whitening, like it's not a great idea. Please don't sue me, Temu. I'm not. My pockets aren't that deep.
Your office has got those trays. There was an upper tray, lower tray kit that you guys had. That was dynamite.
I'm a simpleton, man. I try to make things literally as simple as possible. So I tried everything, and I was just like, okay, this stuff's perfect. Like, and the best thing is like what I use. My dentist wife uses. So like, it's probably good. And we get all these questions all the time about how about this one, how about that one. Like a billion things out there. Sometimes we don't need to investigate every single new thing on the market. And unfortunately, like when things aren't regulated, it becomes a big problem. So yeah, we have the one in our office. I find it works. It doesn't cause too much sensitivity. Whitens. I think it's like $120. I'm not a salesman. But like sometimes people will ask me about like in-office whitening. Like there's a lot of side businesses that people do. It's like $500-600 for whitening. I'm like, you can do it, no problem. But most of what you're paying for is the chair time. You're taking up my time, and I got to pay my staff, so it costs a lot. I talk most people out of the high-end, quote-unquote, whitening. The only exceptions being if you got a photo shoot the next day where you need to be a supermodel, or your wedding is this weekend and you need a real hard, like real super bright white. But for most people, just slow and steady at home with the trays we have work perfectly.